On Nicholas Ward, we do a board round at 9 o'clock in the morning. We discuss all the patients then about all their needs for the day. Then we all meet again at 12 o'clock, where we meet the multidisciplinary team, and then we discuss the things from the morning. The people who should be attending the board round are the nurse in charge, the consultant, then we have the occupational therapist, and we have the physio. And just recently we've had the social worker join us. The afternoon huddle is very important, and it is a good way of catching up with all the team, any of the things that we haven't managed to do that day for the patient, and then put the plans in place for the next day.
The board round is an update session where the members of the team are informed of what has gone on with the patient from the last time we saw them 5 p.m. the day before up till that morning. This helps us to plan for the day. To me, a good board round is when all the members of the team are present and we are all working together to get the patient home. Everybody thinking home first in what we are doing, and that we're all singing from the same hymn sheet, because our plan is to make sure that the patient has the equipment he may require at home or the support that may be needed for him to get home safely.
I find the board round very useful as a junior doctor. It helps me to understand better the roles of the other members in the multidisciplinary team and how they contribute to patient management, especially after patient discharge. And for me, that's very useful as a GP, because I will be seeing these patients in the community once they're discharged. And by understanding better how they're looked after once they go home from here, it will help me to manage them better in community.
My role as an occupational therapist is to identify collateral history of patients so we can work out discharge plans from day one, really, of where their care needs and their equipment needs are likely to be. So, for example, if a patient used a wheeled Zimmer frame before, and that information is critical to a physiotherapist, so we've got shared goals that we can work towards.
The role of the physiotherapist in the board round is to feed back to the team about how the patient is performing on the ward at present. That includes getting in and out of bed, up and down from a chair, toileting to enable the nursing staff to support them to function, and to set very clear goals as to when the patient can be discharged from hospital.
So the key questions which we'd ask during a board round really is, why does the person need to be in hospital? What medically do we need to provide for the person, which means they need to be in a hospital setting? Is there anything we can deliver in the community that we don't need to deliver in hospital? Can we link in with the community teams, such as the Home First team? And can we provide the care they may need in a home setting, which they would normally have, essentially? So the main thing is are we delivering something for the patient? Are we delivering a green day for the patient? Are we adding value to them? Or is there something we can do better in the community setting?